Good morning. My name is Jenna Weets, and I am from Morrison, Illinois. I have been married to my husband, Brad, for 10 years, and we have two beautiful children, Claire, who is 8, and our son, Jeg, who is 5. Today, I am representing our son, Jeg, and he was diagnosed with Niemann-Pick in December of 2017. When Jeg was 2 years old, our diagnostic odyssey began. We started to see a pediatric GI specialist at the University of Iowa because Jeg started to develop perianal skin tags. It took 2 years of the symptoms getting worse and more painful, an upper and lower scope, a biopsy, and at the age of 4, Jeg was officially diagnosed with Crohn's disease. It was during all of his visits to the GI specialist that they found Jeg's enlarged spleen, and with no explanation as to why it was enlarged, in 2017 he was sent for a genetic workup that was screening for a couple different diseases, but they thought that NPC was unlikely to be the cause. We didn't think much of it, and we left 2 days on a trip to Disney World. On our last day of vacation, I received a call that brought our whole world crashing down on us in the middle of Hollywood studios. I learned that our son had NPC, that his disease was fatal, and that there was no hope of saving him. If you didn't know any better, Jeg appears to be a very normal 5-year-old boy. He is funny and smart, sensitive, loving, and full of life. He loves to sing and dance, play baseball, and ride his bike. We find that just about everywhere we go, people gravitate towards him, commenting on how special he is. Brad and I are beyond blessed to be his parents. Jeg has very few symptoms of NPC at this time. He has a slow cognitive response time, a small amount of eye gaze palsy, and his running and jumping are not on track with other children his age. The only symptom right now that impacts his life is his enlarged spleen. He wishes to take part in sports, like wrestling and football, but the risk is too great. We travel 2.5 hours one way every 2 weeks, missing a day of work and school for Jeg to receive treatment for his NPC. Every day we watch him, monitor his schoolwork, watching for any signs that his disease is progressing, just waiting for the other shoe to drop. Right now, Jeg's Crohn's disease has more of an impact on his life than his NPC as we struggle to get it under control. We have to travel to Iowa City for him to receive an IV of an immunosuppressive drug. The infusion takes about 3 hours total for him to receive, and it is an additional 3 hours total of driving, once again causing us to miss work and school. For the last 6 months, he has also been on a steroid, which we are trying to reduce now. When you have a child with diseases like these, nothing is simple anymore. When Jeg started all-day school this year, it meant explaining to the nurse, teachers, aides, and principal what his needs were with his bathroom requests and what the symptoms of his NPC looked like. His doctors are a part of a team that is publishing a case study on Jeg. In the study, they have noted that there is a connection between Crohn's disease and NPC, as other cases are documented. Jeg's case is unique because he is one of a few cases where his IBD presented before his neurological symptoms of his NPC. Usually it is the other way around, and his doctors are suggesting that NPC should be tested for in every case of very early onset inflammatory bowel disease. Jeg's case also shows how important it is for every child with an enlarged spleen and Crohn's disease to be tested even in the absence of neurological symptoms. We were asked what our family hopes for in terms of future treatment options. Anything that will delay the progression of this horrible disease and improve the quality of life those affected will have as the disease progresses. Our greatest hope is for Jeg to be able to live life with NPC, but manage it much like people with diabetes do. We hope that with the FDA's help, a family diagnosis of NPC someday won't be such a tragic one. Thank you so much for letting us tell our stories and for listening to us today. I hope that we can all work together to provide treatments for our sweet little boy and all those affected by NPC so that they will be able to live a life that they deserve.